Thank you, everyone, for joining us today. And hello and welcome. This is the TARC 2025 presentation given by the National Federation of the Blind of Kentucky's TARC Steering Committee. I am your host, Ashley Swafford, President of the NFB of Greater Louisville and board member of the NFB of Kentucky. Please be aware that today's presentation is being recorded. Only presenters are unmuted. Due to the large amount of information given, including important contact information, it is best to take notes. If you have not had a chance to submit any questions prior to today's meeting, please know that you are still welcome to do so. Following the presentation at TARC, that's TARC at nfbky.org. So as the presentation goes on and you think of a question, I would write it down so that you don't forget, and we will get back with you with those answers if we have them. Let me introduce our committee and presenters. First, it is Katie Atkins. She is our legislative assistant and TARC information researcher. Next is Todd Stevens, our NFB of Kentucky legislative director. Laura Stevens is NFB Newsline. Sondra Williams, NFB of Greater Louisville vice president. And although she cannot be with us for this presentation, Angela Henderson, the National Federation of the Blind of Kentucky president. Our first presenter is Katie Atkins. She is going to talk all things TARC and what can we do now. Katie, welcome.
Thank you. Thank you, everyone, for coming. So some of this information you will have already heard. Some is updated as of the most recent TARC board meeting. I did include information that some of you have already heard before, just because there is still some confusion and we want to clear up any confusion before we move forward in this process. So at the most basic level, TARC 2025 is a network redesign project. They're looking at the fiscal difficulties that TARC will be facing over the next 5 to 10 years. And right now we are at the stage where they have developed two concepts that can be used to address the current fiscal challenges. They will be using community input through a variety of methods to help move this process forward. They'll have stakeholder meetings, community events, bus stop pop-ups, surveys, and Facebook interactions, social media interactions to help get community input over the next year. So how did we get here? I think is everybody's biggest question, because for a lot of us, this feels like things were kind of running along smoothly, and then this big announcement that our lives were all going to be upended. So TARC actually started running a budget shortfall of roughly $12 million a year back in 2003. If anybody's been riding TARC that long, you'll remember we had a lot more routes around that time. They used to go out into other counties. We had more express routes, those kinds of things. And shortly after that, we started to see a little bit of those be cut away over the years. Every so often, we would see a little bit of a decline in service. So the past couple of years, TARC, like basically every other transit agency across the U.S., got a ton of money from COVID funds. They got about $112 million that they were used to fill their structural gap from 2020 to 2024. That money is gone now. It's running out quickly. They can't do anything else there. So starting this next year, they're looking at facing a yearly shortfall of $30 million a year. I know there's a lot of confusion about, you've heard 30 million, 36 million, 45, 50 million, all these different numbers thrown out there of how much they need. I'll try to highlight which each one is. So with the the spring 2024 model, so what they had before this most recent cut, they were looking at about being short about $30 million a year. Where is all this coming from? The biggest cost is wages and benefits. That accounts for roughly 68% of TARC's operating costs. And that has steadily risen over the past 30 years. paratransit costs during this time have also risen. They have risen actually 780% since the early 1980s. The early 1990s. There has also been a ridership decline. This actually didn't we probably would think that started with COVID. In actuality, it started both in Louisville and kind of around the nation in 2013. So from 2013 to 2019, they saw a pretty steady decline in ridership. Well, then COVID happened and ridership fell off a cliff. It went down 54%, and they've barely recovered any of that. They say that even though it started to decline in 2013 to 2019, we didn't really see that in terms of service loss. So even though for the past 11 years we've had less and less people taking TARC, they haven't really changed services until this most recent cut. They give some comparison numbers here, and they're looking at different trends of when people take the bus. So in 2019, for example, mornings had a much higher ridership, whereas now in 2023, we actually see the highest ridership towards the afternoon into late evening. There's actually a bump in ridership from 6 to 9 p.m. They also compare midday trips. So this will kind of show you how big the decline is. In 2019, by noon, there would be you'd be looking at 6,000 trips. In current times, we're looking at about 2,500. So it's that's about that 54% decline. Car ridership, ownership, walking and biking have also increased, as well as people working from home. So what they're saying is because of all this decline in ridership for a variety of reasons, even if they had all the money they needed, they would need to look at the networks we currently have in place and adjust them. That doesn't necessarily mean they would have to cut if they had the money, but they would have to look at what areas need the most service and when. And finally, the other contributing factor to all this is urban sprawl. As you all know, Jefferson County is actually quite large. It can take a long time to get from Valley Station to Middletown. And so TARC really provides services to all those areas. So you might have 5 or 6 people that need the bus out in Middletown on any given route. So they send a bus out there right now. And those routes are extremely costly. Whereas if they're running downtown to, let's say, Frankfort Avenue, you might have a full bus, and those rides are much more cost effective. Their major funding source is the occupational tax. They get 0.2% of the total payroll occupational tax in Jefferson County. This was established via a referendum in 1974. TARC can't change it. It would have to be voted on to up this number. This occupational tax also splits money between Louisville Metro government and JCPS. So whatever is going to go to TARC would have to come from one of those sources right now. So that some Metro Council members have said that's kind of a non-starter in their mind at this point. Hopefully in the future we can change their mind on that. But that is actually 60% of TARC's overall funding is that tax. So they do have some other funding sources. 19% of their funding is coming from federal money. Some of that, as I've said, is running out. Their fares, I know a lot of people have talked about, well, they could just up the fare. That is actually a very, very small percentage of their overall funding. Even at really its peak, when ridership was at its highest, that was only around 15 to 17% of the income they were taking in. Right now, it's more in the 5 to 7%. They get a little bit of money from Kentucky and Indiana, some special fairs, advertising, and things of that nature. Kentucky is ranked very low in terms of the overall funding that they give towards TARC. I believe Sean Riley said at our meeting that Kentucky is ranked around 46 in terms of overall funding. When I tried to search that number, I found, depending on the source, it varied just a little bit, but it was pretty in line with what he was saying. So what are the implications of all this? This is kind of where we're at now. So without additional funding sources, TARC, as they said in our meeting, will be unable to make payroll by the summer of 2026. They can't let that happen. So we're looking at what can be done to address that. The only thing that TARC controls is when and where they offer service. They can't raise taxes. They can't do a ton of lobbying. They can try to get some business partnerships, but that's not the main source of their funding. And even more problematic is even with these cuts, even if they do the most extreme cuts here next year for the 2025 plans, they're still going to be out of money somewhere between 2032 and 2035 and would be looking at doing this whole process over again. So, like I said, we are at the concept development stage of this. I want to be very clear, these are concepts. They are two extremes of what could happen. They are not set plans. You shouldn't by any means take them as the final say-so in what is going to happen. They look at several different groups when trying to develop these concepts to see how they can best serve their ridership. This is an area I just have these listed. If you want more information about these specific categories, I would send an email to the email address that Ashley gave, and that will be said again here at the end. But they looked at residential density, job density, activity density, street connectivity, areas of persistent poverty, zero vehicle households, senior density, and youth density. For a lot of these, there's a lot of overlap, as you can imagine. So they see, for example, there's a lot of residential density around downtown, around South Louisville, that area. There's also a lot of connectivity in that area. The way the streets are designed, it's easy to get from one place to another. It's more of a grid pattern. Poverty is also high in West, South Louisville, those kinds of areas. A lot of people without cars in those areas as well. So with taking all this information and the results of kind of that first survey that most of us filled out towards the end of spring, early summer, they've developed three concepts. The first two are the constrained concepts that I think most of us are most familiar with. This is the ridership and the coverage concepts. Again, they are not final plans. They are extremes. They don't want you to think of this as a binary choice. Do I either want frequent service or do I want more service areas covered? And they see it as more of a sliding scale. So if you're asking the general ridership, where is the trade-off? What am I willing to give up less frequent service on this route to have this area covered, and vice versa, and seeing where most people fall within that. So they also, with this, are looking at not only what areas should be covered and how frequently, but how far a person should walk in between bus stops. I think that's an important thing to keep into consideration for our groups. As we know, there's, even in areas where you think there'd be good sidewalks and things like that in Louisville, there's not. So what they're saying is, right now in a lot of areas, there's a stop about every block. If they spread this out to every 3 blocks, then you are able to offer more frequent service to more areas. And the bus routes will go faster in general. But again, you have to balance that with who is able to do those walks. Are our senior community able to do those walks? Are different people with different disabilities able to do those walks? Are parents with small children able to do those walks? So they're trying to balance basically the needs of the many versus the needs of the few, and see where that balance is that best covers as many people. So with the 50% cuts, this is kind of a drastic way of looking at it, but I thought it was worth mentioning. They said you can look at the network map and imagine 2 out of every 4 routes disappearing entirely. Or think about a bus that comes every half hour, but imagine now it comes every 60 minutes. Can you or can your neighbors afford to wait that long? Or look at a bus schedule and imagine service disappearing for over 3 entire days of the week. But that's a very drastic way to look at that, but that's when they're introducing that, how they thought best and easiest for people to imagine that. And when they're saying that, the 50%, they're saying based off what we had back in April, May, our spring 24 concepts. So right now, and this is where there's the confusion about the 50% cuts, we've already lost 20%. That was what happened in July when we went to what they are calling a Saturday Plus schedule. So the ridership concept and the coverage concept would get us that additional 30%. They just do it in different ways. So the ridership concept, it would allow high frequency service every 15 to 30 minutes to a smaller area of Louisville. This is really kind of concentrated around downtown, the West End, Old Louisville, Frankfort Avenue, Highlands, kind of that area. They're looking at really job centers. Can we get to the hospitals downtown quickly? Can we get to UPS Worldport? Can we get to Mall St. Matthews? And how fast can we get there to make this usable? They say throughout that the committee that is looking and creating these concepts doesn't have a preference. But what you'll notice when you're able to read all this is that they use very favorable language towards the ridership concept. Frequency is freedom is a reoccurring theme that you will see. So on average, more people can get to more places faster. So what they see in other cities is when you have a high frequency service system, you'll actually see an increase in ridership. Just some general areas, again, these are concepts, so not final plans, but areas that would no longer have access under this ridership concept would be Clifton Heights, so that's that lower Brownsboro Road. Clifton, that's proper, that's Frankfort Avenue, would still have access, but anything that's lower Brownsboro, those side streets, the Clifton Kroger, that kind of stuff, those would no longer have access. The McDowell Center is not included. Most of Middletown, Jeffersontown, Fern Creek, and large sections of Valley Station would be losing access. Okay. The coverage concept. This would keep really kind of the same service map, but it would drastically reduce service frequency. A lot of areas would have to wait up to 2 hours between buses. TARC argues that this would lead to an overall decline in ridership. It's just not practical. So we think of it in terms of, I think a lot of us, well, we can't drive, so something has got to be better than nothing. But for your average person now that has lost also their JCPS transportation and has to get to work and everything else, they can't have 2 hour, it takes 2 hours to get to work. It takes 2 hours to drop my kids off. It takes 2 hours to pick them up from school. It's a full-time job just riding the bus. And if you miss one, your entire day is ruined. Let's see here, 1 second. Go down. So with comparing the concepts, this is where some of those percentages that we heard the other night at the meeting, I was able to find them within our documents. So compared to the spring 2024 model, again, that what we had before the, the Saturday Plus schedule that we have now, the ridership will see a loss in access to 13% of jobs. That equates to 8,700 fewer jobs. The coverage will see a loss of access to 38%. That's that 38% number they said, which is 26,200 jobs, not 38% of all of Louisville. And they're measuring this by how quickly people can get to a job midday in 60 minutes or less. So, and then with comparing proximity to service, 26% of residents, this is all of Jefferson County, or around 204,000, are no longer near transit under the ridership concept, versus 3%, or around 26,000 residents in coverage. So again, it's that trade-off. Do you need to be able to get to a job quickly? Is it going to be usable if you can't get to that job quickly? Versus how close are you actually to a bus stop? So, and then with just a couple exceptions for a couple individual routes, and if you're curious about how that would look for the area you live in, please send an email. Most routes will run from 5 a.m. to midnight on weekends as well as the weekday, and service times will be similar. They also, especially under the coverage concept, are looking at putting hubs downtown. This sounded like, for anybody that's ever rode LexTran in Lexington, you get off of one bus and you wait downtown and there's a line of buses you can choose to get on. It makes transferring and going places really easy. I think a lot of us in Louisville have wanted something similar for a long time. but they would make sure that there was at least a couple spots downtown where buses could wait so that it was easier to transfer to another one. Again, especially under that coverage concept where it's going to be so important to make those connections. There are some eliminations that they are saying would be very unlikely to be under either model. A lot of people have suggested that for the McDowell Center, for example, that they have an express bus that would go there at, let's say, 8 a.m. or 5 p.m. to pick up people, that would be the solution. Under most of these models, there's not going to be circulars, there's not going to be peak busing, there's not going to be express routes. Those are extremely expensive to maintain and run. If you think about it, you have to have a bus that is pretty much just dedicated to going out to those areas twice a day. So you're spending millions of dollars for 2 routes a day, and it also causes a labor problem. You either have to take a bus driver off of a route to cover those, or you have to hire bus drivers that are just covering those routes that are very kind of at awkward times of the day, different shifts, that kind of thing. And the circulars, like we used to have, I think of the circulars as what we had downtown around the hospitals and stuff. It's just not enough people use them to make it worthwhile for the overall cost. Okay. So those are the 2 constrained concepts. Those are what we are giving the most feedback on right now in those surveys. The third option is the growth concept. And I know a lot of people have written this off because it does cost more. And if they don't have funding now, well, then they're just not going to have funding, period. But I would caution, it's still very early in the process. I wouldn't write that off. If they're already 30 million short, they're saying they need 50 million. That's where that 50 number is coming from in order to implement the growth concept. That, in terms of big budgets like you see at the state level, that's just not a huge difference in money. So this is kind of the best of both worlds, really. It maintains most of the current service map, and for those high frequency areas, again, the Highlands, downtown, Old Louisville, Clifton, you can see 15 to 30 minute service. It also allows to have some more connections between routes. So things that aren't previously Hurstbourne and Bardstown Road, I believe, was an example. There's 4 or 5 connections that they could create with new routes with this as well. I know that's really important to us to have ease of access and getting back and forth to one place to another, and having those. That was a big deal when the 25 was created several years ago, was it connected regions that weren't previously connected and required multiple transfers. So overall, it would be 12% more service. And what they found when they compare peer networks, so a Columbus, a Cincinnati, those type of cities to us, is that when you make improvements like this, it actually leads to an increase in ridership. So, I mean, the fares aren't a lot of the funds, but it would lead to an increase there as well. And I think that's an important point to consider here long term, is to point out that it would lead to an increase and would be a more usable service. The main question I think everybody's asking long term is, what does this mean for TARC 3? And the simple answer for that is we just don't know right now. They say very clearly in these documents that they are only focusing on fixed route services at this time. Now, when I asked at our NFB-ACB joint meeting that we had on the 16th, I was told that TARC 3 plans would be announced in January. I'm going to go over the timeline in a minute. I think that month has probably changed slightly. The problem that a lot of us see, though, is they are talking about how much paratransit costs. And they're not wrong. ADA did create a mandate without a funding source in place for it. And it's also extremely expensive. Even, I've seen the idea thrown out that, well, maybe we could just add $2 here or $3 here. That any little bit helps, yes. If that is your idea, please include it in your survey. But long term, it's not going to do anything to cover that massive gap. They're going to need funding there. They repeat the ADA requirements when you ask them about TARC 3, which is that they have to provide services within 3/4 of a mile of a fixed route stop. So that leads, I think, most of us on this call to believe that whatever model they end up going with at the end of the day will only offer service within that. We don't know that for sure, but that would be my assumption just to be on the safe side at this time. Others have brought up grandfathering people in. There's not actually, yes, that has happened previously under different TARC directors, but there's not really a mechanism that requires that. And I would just caution people to also think about what that means long term. Since there isn't a mechanism, that could look very different. You know, let's say they grandfather you in now and you do get to keep service. Well, can you switch jobs? Can you move? Or do you have to stay within those same areas to keep that service? What happens to anyone that becomes too disabled to take a fixed route after the grandfathering in process? What do we do for all the people that are coming after us? That just, again, you can put that in there if that is something you believe is a good idea, but just think about I would caution people to think about the implications and how that will affect everyone, not just now, but long term. In terms of that first survey we took, it is the vast majority of people are leaning towards, it's about 72% are leaning towards the ridership concept. And I believe it is looking, I know the distance people walk is an important aspect. 3 blocks, I believe, is what the average person is willing to do instead of the current 1 block situation. Okay, so the timeline, like I said, it's been updated. So right now we are in the community conversations part of the first concept proposals. They have moved the survey deadline. At our meeting, they had said September 19th. It has now been moved to September 20th. I was under the impression, based on the timeline I had previously read, that we would be getting our next round of, these will be actual proposals, draft proposals, in the November, December timeframe. That has been moved to November, December, when the draft proposals will be created, not sent out. So then in January and February, they're going to have these same community conversations again. They'll have their open houses, they'll have the bus stop pop-ups, there'll be another survey. We get to do this whole process over again. And there will be another survey that is coming out that will have a deadline of, at this time, February 12th. And then the February to March, TARC will again review the community feedback that they have gotten on their draft proposals, and they will be releasing the final proposals in April. That time, they're saying August 2025 is the earliest that they plan on implementing these changes. That's what they're saying. I take that for a grain of salt. We weren't supposed to have these most recent cuts until January of 2025, and we ended up having them in about 3 weeks since after they were announced. So that time between April and August is when they're going to be changing the route descriptions, changing where bus stops are, and just doing a lot of community action work to make sure people know that their buses are changed. That's kind of the information we have right now that I've been able to pick out of the documents they've released, and also from their 2025 fiscal budget and their board meeting. So what do we do now? How do we stop this from happening, I think, is everybody's question. Right now, TARC has made this process difficult. Metro Council passed their budget back in the spring, and we just started a new 2-year cycle for our legislature here in Kentucky with funding. So the most important, I know all of us want to get on the phone and call our senators and call the governor and call the mayor and demand funding. Hold off on that. There's a time and a place for that, and right now isn't the time and the place for that. Most importantly, right now, you want to make sure you understand the concept. Don't just think about, where do I go to work? Where do I live? Think about, where do I shop at the grocery store? Where do I go to church? Can I get to my kids' school if I need to? If they're sick and I need to get there, can I get there on a fixed route? Can I get to the park? Think of all those things and how each concept would affect them. If you need help with, I know the maps are a nightmare for accessibility, and even their description that they put out on YouTube, you have to really have an in-depth understanding of how Louisville is laid out. If you need help, you can email that TARC email address that Ashley gave at the beginning and will be given again here in a minute. And if you can give me major cross streets, I can do my best to try to tell you what it looks like under each concept. So make sure once you understand them, all your questions are answered, that you fill out that survey. The survey is accessible. Any comments? I know there's been some critique of the questions they ask in the survey. On the very last page, there's a spot for any additional information. I wrote a couple paragraphs in this section. I mentioned the Kroger that is by me and serves a lot of disabled people, elderly people wouldn't have access. Anything that I thought they missed, I went into detail and added it in there. And that's what I would suggest everyone to do. Also, make sure your friends and family, your coworkers, everyone is filling out this survey. They announced in the most recent board meeting that so far 1,071 people have filled out the survey. TARC seems very pleased with that number. That to me seems, if you think about overall ridership, seems like an extremely small amount of people that have actually filled it out. If you want to look for a plus side in that, though, that also means it's more easy to get your voice heard. If more people are saying, hey, this area has got to be covered, or you've got to remember TARC 3 when making these plans, that's going to have a larger impact than if 10,000 people had filled it out at this point. So again, make sure they fill it out. Don't assume, even if you work at LCI, APH, KSB, McDowell, any of those that have a large ridership population, don't assume people know. Make sure they know the survey is out. Remind them of the deadline. Ask your friends, family, people you go to church with, everybody you can to fill out that survey and let them know why it's so important to you. Again, then attend community events. These are the bus stop pop-ups. There's going to be open houses here soon. I know all of us, or mostly everyone on this call, went to the ACB NFB meeting. That's fantastic. But we want them to see us and to see that we are spread out all over Louisville. These issues matter, and we're not going away. And part of what I would ask you to do with this is, while you're there, introduce yourself to people. Lauren and I went to one here recently, and we were able to meet a small business owner in our area and somebody that was on their neighborhood association. And we were able to tell them why we were there and why this was important to us. Cassie, when she went to the bus stop pop-up, met someone that TARC had contracted with, who had heard similar concerns of Kathy and the rest of us, but hadn't heard much about TARC 3. And he gave contact information so that we can follow up with him now. So make sure you're making those connections. And I would also ask you, if you are trying to reach out to TARC in any kind of way, whether it's to ask about a community event, or if you're interacting at them at one of the events, if you don't mind, I'm trying to collect some data about TARC's communication practices. Please send an email and just let me know how that process has gone, whether it's positive, negative, anything in between. I need just all experiences. I'm looking for trends in communication. So if you know who you talked to, if you know what time of day you called, what you were asking for, just basic information, just send me a quick email when you have time, please. And then finally, in terms of legislation, again, I want to say we are not asking you to leave a message with anybody right now. Elections are just a couple months away. It's not at the right time in the fiscal calendar. But we do want you to call and find out what your district is and who your representative is, so that if we do have a call to action, which we will be working on developing here in the coming weeks and months, you can quickly make the proper phone calls. So for Louisville Metro, this is one of the numbers you're going to need to write down. You will call 502-574-3902. They might tell you they have an interactive map on their website that you can put your address in. Tell them that doesn't work for you. Give them your address. Tell them you need to know your district. You need to know your council person's name. For Frankfort, you want to call and you want to get who your House member is and who your Senate member is. You're going to call 502-564-8100 and ask for, again, your House member and your Senate member. You might have to call an update here in a couple months after elections, depending on how they go, but you need to have this information now. And that is about all the information I have at this point. Like I said, if something was not clear, I talk very fast. Please send an email. I will answer any question I'm able to.
Thank you, Katie. Again, for any following remarks or comments or questions, you may email Katie at TARC, that's TARC at nfbky.org. Thank you again, Katie. That was wonderful information. Our next presenter is Todd Stevens. He is our National Federation of the Blind of Kentucky's Legislative Director. Hello, Todd. And Todd will be sharing with us what is NFB of Kentucky's plan.
I know that many of you are asking about how we're going to tackle this. And because we, the National Federation of the Blind of Kentucky, feel that we've got a plethora of contacts in our national office who are also used of tackling these types of issues, we feel that it's best that we take the lead on this. We've got plenty of resources and places. We've got plenty of contacts. And because of the legislative meetings that we hold every year with our Washington seminar, we also feel that we are in a really good position to have made those connections and partnerships with federal and state legislative, with the federal legislature. But we've also had the opportunity to make contacts with some of the folks in our state legislature. So what we are going to do is we are going to develop some talking points, because this is a call to action. But we want to make sure, please understand that the message that resonates loudest are those that are clear and concise. So we are developing a plan for that, and we will let you all know who are listening how you can assist us with that, because there are strengths in numbers. So this is not a situation where we feel that we can handle this by ourselves, and that is the steering committee. We need everybody's help, but we want to make sure that this message is clear and concise. We're all on the same page, and we can pound this drum so that it is, again, consistent and clear with all of the folks that we need to contact to solve this funding issue. And please understand that it only is going to start in Louisville. And, you know, Louisville is the largest city in Kentucky. We have to do everything we can to make sure that this 2025 plan does not come to fruition, because what this means is that this is going to set a standard for how things are going to spiral out of control for the rest of the transit and paratransit systems throughout Kentucky, and maybe it could be a blueprint for other states. So we have to keep that in mind. This is a micro issue, and we need to make sure that we are tackling it at the macro level, the larger level, so that we can do everything that we can to shore this up. It's always been a problem. Transportation has always been a problem for those of us who are disabled, but we want to do everything that we can to cut it off at this level, and that is with TARC, so that it doesn't spiral out of control and affect other areas as well. So we will keep you posted on what we will need to do together, and then we can take it from there. That's really all I have to say this morning. Thank you all for joining us.
Thank you, Todd. Our next presenter is Laura Stevens. She is going to be talking about how to stay informed.
Good morning, everyone. So as we go through this process, as Todd says, we all need to be on the same page, and we all need to have an avenue so that we can stay informed and know what's going on. And Um, there are going to be multiple ways to stay informed. You can look on the NFB of Greater Louisville Facebook page, as well as the NFB of Kentucky Facebook page. In addition to that, there will be information posted on the NFB of Kentucky listserv. And if you are not signed up for the listserv, you can sign up, you can request to be signed up for that by sending an email to tarc@nfbky.org. That's TARC@nfbky.org. In addition to the NFB of Kentucky listserv, there's also going to be an opportunity for information to be disseminated through the NFB Newsline audio reading service. And anyone who is eligible for this service should be someone with a print disability, anyone who has a visual impairment, or even individuals who have cognitive or learning disabilities. And in order to sign up for this, you can also send an email to tarc@nfbky.org. In that email, you'd request to be signed up for NFB Newsline. We need your name, your email address, phone number, and address. And you can send an email to that address as well for NFB Newsline or for the NFB of Kentucky listserv. Just let us know in the body of the email which you would like to sign up for, if you would like to sign up for both. But these are going to be the ways what you want to keep people informed and where we are in this process and where we're going to be moving forward. Thanks.
Thank you, Laura. Our final presenter is Sandra Williams. She is, again, my vice president for the NFBGL, and Sandra is going to have our closing.
Good morning, everyone. I think that we can all agree that we have been given the opportunity to hear and better understand a wealth of information, valuable information that will help push us forward. I would like to give a few thank yous. We would like to thank Katie for her thorough and conscientious research efforts. Thank you to the National Federation of the Blind of Kentucky for supporting the efforts in Greater Louisville during this time of uncertainty with our transportation. And finally, a big thanks goes to all of you who have given up a portion of your morning to receive this information. Thank you. Be safe. Have a wonderful weekend. Go Cards. Go Cats.
Thank you, everyone. Again, follow up with any questions at TARC, TARC at nfbky.org. Thank you again. Have a great day.